I think my daughter was also on this committee when she was at CB6.
Your,
My daughter, my
Oh.
high school daughter, Aisha. Aisha was on your committee, I think.
Aisha.
Now she's in college, so that's why she
I
stopped.
see.
She's the one who got me to apply.
That-
Nice.
Yeah,
Okay, so we are ready whenever you are, LB.
all right, okay, so good evening, everyone. Welcome to the September 2024 meeting of the Health and Environment Committee. My name is LV Barosa and I'm the chair of the committee. Tonight, we are joined by Assistant District Manager Brendan Burt. This meeting is called to order at 6:37 p.m. As a reminder, New York state law requires all committee members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, do we have any?
We have a few.
You can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there is time following the committee's discussion, we will field questions from the public. We need volunteer to take minutes tonight.
Can take
Correct.
minutes, yeah.
Thank you. Thank you so much, Barak. So Barak will take the minutes tonight. And we will now take the attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name. When your name is called, please say present. I will announce if there is quorum. Marty Barrett won't be with us tonight. Ellie Barosa,
Present.
Barak Friedman,
President.
Sandra left off. I don't see. David Levy won't be with us tonight. Neither will Kevin O'Keefe nor Miriam Rowe. And Mubin Siddiqui.
Present.
We do not have quorum.
The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the April 11th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the April 11th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members who are here in person, if you have a question about committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Committee members unable to attend in person, you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. All committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. Tonight's agenda, the discussion of health and environmental issues in Manhattan Community District 6. So, members, any issues. We have one that was presented, the air quality.
Yeah, so, yeah, I'll share my screen. So some point last week, I think it was last week, we saw in our inbox, the office saw in its inbox, some, like larger scale air quality reporting from the New York State Department of Environmental Conservation, DEC. And they really wanted to focus on, I think it was 10 vulnerable areas in New York City. And Manhattan was one of those areas. So for these vulnerable areas, they have these community profiles outlining obviously history and different air pollution sources and where certain types of pollution are the worst. Like for example, we're going to, like this is a type of pollution, nitrogen dioxide PM 2.5, that's particularly bad in our district. So, I mean, this report is of interest in general, but whenever I've come across different air quality measurements, it seems like a number of the measurements show our district not having the best of air quality compared to many other parts of the city. So that's something to think about now that environment is in the committee's purview.
Right.
As to how the committee wants to go about that, that's up to you all, but
Yeah.
there are some types of air quality where
Vera?
it's,
How do you know that?
Just to say that we did, pass a resolution last
About air quality.
May, with recommendations that, was pretty good. And like you said, we were one of the worst, air quality in the entire city, with CB5 being the worst. And we were the fourth worst in the entire city, worst in the Bronx. Yeah, well, the traffic in Midtown is much worse than anywhere in the city. And so we get massive amounts of pollution here, and CP6, of course, we have the Midtown Town Hall, we have the FDR, so we get massive amounts of pollution here. So, it's worse than anywhere in the city, in Midtown, specifically CP5, but to a lesser extent CP6. So we did pass a resolution to kind of address some of those issues.
Yeah, we did. And they are, when is this? They have a public meeting about this on September 23rd at 6:30 in the evening at 6th Street Community Center. So,
Is the nitrogen dioxide, is that due to
yeah.
the
the
cars?
nitrogen.
That's all, is that what that is, pollution from cars?
yeah, it's from vehicle pollution.
Okay, thank you.
The 2.5 was the worst one because that's, goes deep into your lungs because they're very small particles. And there's a lot of damage, so that's also mainly from cars.
And not good for those with medical condition like asthma.
And all the hospitals are right there too. I mean, it's right, the heart of where NYU and everything is.
Yeah, Bellevue Hospital as well.
So Brendan, you can probably share this to all members and anybody who's available to attend the meeting.
Yeah, absolutely, absolutely.
What was one of your biggest, the main thrust of the resolutions that you passed? I know I will go back and look at it now, but
Right, we had a bunch of recommendations based on what the number is, and that a certain number should trigger, and if I remember correctly, it was like 150 or something like that. If it was 150 particular matter, that would trigger, that they would have carpooling lanes
I see.
and encourage, public transit and.
So
And
ways to reduce
hand out
traffic.
masks, for people to deal with the pollution. Those are some of the things, yeah.
Thank you.
It's one of those things, the community, it needs to be publicized in the community, however one would
Yeah.
do that, since, the rest is, it's a response too, so the masks, do it, but when community members know, then they have their own options of how they want to proceed, so I don't know how you inform the community in a good way that probably jogging is not the best idea along the East River. I mean, when you think about it, that's where everybody goes. So, but again, it would be a question of how does one inform the community about the risk? So carpooling is fine, but the probability of that happening in the city is probably very low, in fact, that I would think, but, et cetera. But community members should know what the risks are that they're taking. So I don't know, it's just sort of how do you inform the community?
Can we mention in the newsletter?
But not everybody subscribes to it, so.
The newsletter, I know, we really so need a local newspaper. I mean, it's just where people can find out what's going on, but.
Does CV6 actually interface with some of the biggest buildings in the neighborhood also, which have thousands of residents, maybe putting up our flyer, encouraging people to sign up to the website, the newsletter, etc. Is that something we've done historically?
Maybe in the past, I don't think during the time that I've been here so much, but maybe it's been done at some point.
We did during, what was that, something about vaccination, not COVID, that was, no, it was before COVID.
I think just engaging somehow, because I know I've lived in the neighborhood for over 20 years. I really got involved with community boards when I started my own nonprofit. That's when I even learned about the role of community boards and how much work, incredible work that they do for every neighborhood they or district they're in. I think most people are very ignorant of that, or unaware of that, and it'll be helpful, I think, if, I know I'm certainly happy to post whatever this group says in my building, subject to the building's approval, but certainly encourage people on WhatsApp to please sign up for community board, show up for the meetings, dial in for the meetings. But I agree with you. I think like when I used to live on the Upper East Side, there used to be cancer clusters all over New York City, and we would get the information through different sources. I did not know. I know New York in general has terrible air quality, but did not know that such a cluster was right there down the street from us. So I think it's important, and there's a lot of seniors that live in my building that I think would love to know.
The other way, I just remember this in China. They used to have bulletin boards, right? And I think it was the best way to communicate, though it may have been censored at various times, I don't know. But the idea of the local information of a board, and you put up what's going on various street corners, I think would be a wonderful innovation in terms of community voice, and distributing information and so on. And there's always problems going into somebody else's building, but the kind of, the outdoor, I don't know, what's the ruling?
We
on
do
that?
have local papers that we can reach out to, like the Village Voice, there's different papers.
Right, but this is
in the city.
this is in the public purview,
Domain, yeah.
not picking up the voice or anything, that's fine. We used to have a very local one. People tend to, in this area, they read the voice, I don't know. So that's what I would think was, in what ways can we publicly let people know, inform, what the issues are, whatever, on many levels.
Can we use the Instagram, Community Board 6 Instagram specific to this committee?
But
Is
that
that
is still
permissible?
not what I'm talking about. I'm
Yeah,
talking about a
it's talking
public
about the
demonstration.
public.
No, no,
I'm not
no.
talking about internet or anything else. I'm talking about visually present. I'm from the old school, sorry.
What were you envisioning?
Literally a board. I remember this in Beijing. I can't remember, maybe Shanghai, was still catching up. But they would literally have a information board, or whatever. you put the little tax in,
Hmm.
and people would put notifications up, right? Now, there probably were plenty of political things I couldn't read Chinese, but the point was it was supposed to be a public information source that would be on various street corners. And so you're it's be part of the public's, part of the communication system within a community, and I just thought it was a great idea.
What about New York City Links? I know our nonprofit has just recently started using it and we are loving it because it's in the public domain. Yes, it's only up for 24 hours, but
Where
it's
is it?
free. You know how when you're standing at the bus stop, there's a
Yeah.
few different locations in every neighborhood, but in Midtown, I think there's at least 3 locations within walking distance from here. And when we have park events or environmental events, etc., we use them and it has been successful in a sense.
Yeah.
So that might be some way to do it, maybe once a month if you can get a free post up there.
It's a cool links.
I think it's for New York City Links.
Okay.
I can find out more about it, but
Okay.
because we have someone for social media who handles it,
Okay,
but it's free and it's open to the public. And as you're standing on the street corner, your ad can pop up anytime. I mean, they tell you the times it'll pop up,
mhm,
but it's in the public domain.
okay.
We can explore on that. Okay, so, yeah,
Yeah, just a couple of other things to introduce the committee to, just to sort of think about. One is that the city, the city of New York has community health profiles, which has
Yeah.
health statistics broken down, in the different community districts in New York City, including our own. With things like healthcare, health outcomes, maternal and child health, et cetera. So looking at our own district's community health profile, which, you know, I can send to the committee tomorrow. That might be a tool for you all to explore, like, how do you compare to the rest of the city in different health metrics? And that by itself might give some committee members ideas. I was talking,
so are you looking at the 2018,
I think this is a more
recent one?
I think this is a more recent one, but I'll double check. I know there was one in
2020?
Okay, this says 2019 to 2020.
Yeah.
Don't know if there's anything even more recent than that, but
No, there's nothing. This is done by the Department of Health.
yeah. But even if it's from a few years ago, it might still be instructive to the committee. So, yeah. Like I said, it might give committee members ideas of like what health issues.
Well, health issues, the three most are, obesity. The first one is, cardiovascular, obesity and hypertension. Let me see what
Yeah, I mean-
yeah, obesity, diabetes and hypertension.
Yeah, I mean,
Those are the ones within our area.
this district, not as much so as in most of the city. But there are some measures where we're well outpacing the city, like psychiatric hospitalizations. We have a much higher number of them in our district than, on average, than even in Manhattan or the
Wait,
city.
are these members of the community or are these people who are sent to Bellevue, et cetera? Are these admissions to the psychiatric hospitals in our community or are they community members? It's a big difference.
Yes.
These are
If they're,
community,
they're coming from the community, that's the data
they're
that they're
coming
based
from
on.
the community.
As opposed to living in. like,
No,
coming
as
from the-
opposed to
No, I know what she's
Bellevue is where they're
asking.
sent to, right?
Mhm,
And
yes.
so what you don't want, no surprise, Bellevue has the highest admission rate because that's where everybody sends
Mhm.
somebody who's a
Yeah.
problem.
It's
So
a
that's what I'm
special-
asking.
Yeah.
Like,
That,
patients could be coming from anywhere, right?
Yeah, exactly, and
That's
the police will
just-
by and large gonna bring them to Bellevue.
yeah, that's a good question.
That's an important question on
That's
that
a
data.
that's a very good
Yeah.
question, because, yeah, I know.
I wouldn't trust it otherwise.
I know Bellevue has a psychiatric ward, if I remember.
My husband was, I worked there, my husband ran units there and so on, so I know it very well. So
Yeah,
I know we know the flow of patients there.
yeah, that's a very good question, that I had not thought of.
Okay.
That,
No, you'd have to think about
Yeah.
psychiatric
I don't
conditions.
think it's regional, anybody can be admitted because it's the specialization, right? When you have, especially infectious diseases, it specializes in that. So when we had some of those very threatening diseases a decade ago, they all went to Bellevue, no matter where they came in, New York City. So I agree with you, I don't know if this is necessarily a reflection of Midtown.
mhm.
Or just where the police bring people, that's just what happened.
So I think this is coming from Manhattan, like Manhattan and Stuyvesant Town, because when they are admitted, it says in there where is the residence, the address.
Right.
So that pertains to Manhattan and that pertains to Stuyvesant.
But that would be all of that. Well, it's one of those things you could find out usually, what the basis, what data they actually collected for you doing that.
Yeah, I'm looking at the who we are, I'm inferring that it's based on who lives in our district.
Yeah.
Rather than who comes to our district.
Yeah, it's based on the address.
Uh,
Yeah.
yeah, I'm given that we have Bellevue Hospital. Their
Okay.
question.
I have a thought, so maybe we might want to work on. Well, I'll do it for the year or whatever. So one of the issues is, I think of senior care. Which is, again, very personal, but that aside, the notion of, what are the issues of senior care? I was just thinking, I don't remember where I was noticing, it was a wonderful community center. We don't seem to have, as far as I know,
Yeah.
community centers. Which means that older people really are stuck in their apartments most of the time. We don't have the outreach that the Upper West Side does and so on, for older citizens, or, residents of the community. So one of the things we might want to do is to even do a survey. You could work with whatever, public health, the CUNY graduates, and, one of the CUNY, branches, to, get some idea of what the, quality of life issues are for seniors in the community, what's really missing that we want to promote, and go from there. So we have a rather specific targeted group. And then we could come up with very specific goals of, I could certainly think a community center, a well-run community center would be terrific. I was thinking Waterside, but I don't think, not Waterside.
We have that in our budget
Yeah,
request for, it's not, Brandon, we have that in our budget,
Yes,
the
so,
request for. And first of all, we don't call anymore senior citizen,
You don't
That's-
call what?
senior citizen. That's changed to older adults. We don't call anymore senior.
yeah,
What senior gave you prestige, but I didn't think, no, I'm wrong.
yeah,
Older
so
adults.
one of the committee's budget requests was changed, I think earlier this year, from new senior center to new community center,
Yeah,
so.
They got seniors. Right, but also I thought of it in the larger sense of it would be useful, and maybe they have this kind of data on issues of, senior quality of life, health, outreach. What's
outreach
missing
to
here?
older.
Yeah, I'm not using any words anymore. Whatever, you know what I'm talking about.
They said it's degrading the
Seniors.
seniors, so we
I think
don't
all
want
this-
that.
Well, that's all right, because we
Yeah.
have too many words and then not.
Anyway,
acceptable.
I think we're an aging population in general, right? All of us are aging every day, regardless
US
of what
is an
age bracket
aging
we're in. So
population.
it's a need that is there for some, maybe sooner than later, but I think it's clearly a need. I didn't realize we didn't have a community
It
center
was
in
amazing,
Midtown.
but we
Yeah,
don't,
that's why we have that in our budget request,
for what are you requesting then?
to have a senior,
Well, new
Communities.
center.
a community center.
But we can't pay. Just so I understand what the.
So is there a-
funding
is
would
there
be
a,
for? What would it be for exactly?
criterion there for who can use the community center? Or is it
Well,
for anyone and everyone that lives in Midtown?
Well, we open it to everyone. Before we catered, we specifically focused on the senior, but, for some reason they said, oh, it should be catering all
I think that's a
ages.
great idea. I think this is,
Because we had one at Ninth Avenue before, but that was closed.
What would it be?
We have a,
so
we
they're
have a
looking at another
community health
committee, they're
center.
looking at what to do
The-
with
the
the
prob-
water side.
No, the problem when we were looking for that one is location. We couldn't find
A
any.
central location.
Yes. That was the problem. But we wanna put that again in the budget, so in case,
So they're trying to
They
figure out
can
what
allow-
to do with the dining facility on near Waterside Plaza.
You're talking about the border.
Yeah,
club,
the
whatever.
boat club.
Yeah, yeah.
So, I mean, I don't know, people would consider that central location, but
Trouble
that
is
certainly
it's
is something
very
worth
hard.
considering
But it's very hard.
to get there.
Oh, sure. I mean, that would be a
I
challenge.
mean, the buses definitely go there, but.
Right, but if you want, it depends. It's just hard to get to, but it would be, of course, lovely. But I think the first part of it is to assess what you're saying. You've turned it around a little bit to just make it a general community center. I was bringing up the issue of assessing needs of
Whole
of,
town.
The
of
older
whatever you wanna
adults.
call them, in the community, and then going from there, establishing what is missing that would be useful. And so maybe jumping to a community center, and now it's open to all ages, someone begins to change the topic.
Yeah.
Um,
Be-
so,
because about 7 years ago, we did already a survey for seniors.
oh, so you have that data.
Yes, we had that data. That's why we came up into
The idea of having a
asking, the
community
idea of
center.
asking a center for seniors. But all these years that was changed to just community center.
But
And a
we-
global pandemic has happened since 10
Yeah, of
years.
course.
Yeah.
It's changed things.
That,
Well, would
So
it-
this has been on the table for almost a
Yes.
decade?
yeah,
Wow. And we have the budget, but we just don't have a location.
no, we requested a budget, we never,
I don't
And
know.
who did
given
we
a
request the
budget.
budget from? It's a budget for the community board as a whole?
yes, it's part of,
Well, the budgetary issue according to the agency response, and this was when this request was called New Senior Center.
Mhm.
The issue was actually state and federal funding, if you look at the agency response. So one thing for all members to keep in mind is when looking at budget requests, to take a look at the agency responses. Because that will, in some cases, agencies give a very general unhelpful response. But in this case, it's like, okay, so there's a question of federal and state funding.
so you can see in there, the previous one that we requested is new senior center. And that was changed to community center. So it has been there. It's almost 10 years. I've been here 10 years. That was brought up the first time I came to,
Basically,
The
they're saying that
board.
there's not adequate federal or state funds, but I know in the discretionary funding pools with city council, every other day I see RFPs that are going out, but they still call it senior programming on there, certainly in the city's portal. So clearly there is money that can be applied for. Obviously, what you're suggesting is a very big capital project, but they do have funding for capital projects that you can reach out to council members, et cetera. And I just don't know how the community boards interface on that front, but certainly nonprofits go to them for capital and discretionary funding, and there's certainly plenty to be had.
yeah, and the thing is, the office should also push on that. It's not just coming from the committee, but
Right.
I also need the office to push on that.
Make
But
prioritize that.
Yeah.
I'm just a little confused. Who's the agency you asked for the funds? How much funds did you ask for? And was the community board going to develop a community center, or were you trying to use the money to do outreach to get some not-for-profit? So, I just need somebody to explain that.
well, we requested to have a center that's within our district that will provide health services to,
Oh, hell, okay, so not a community center, but what I'm asking was, you request funds, I don't know from who, and I don't know what to do what, was the question. Let's.
where is that going? It's request by the committee to the office to put in the budget
Well, as a budget
As an-
request.
as a budget request.
Wait, but if you're gonna do a community center, that's like millions of dollars, right? I mean, it's not, so. And the community board doesn't have that kind of money, so I assume what you're doing is you have a little seed fund to reach out to not-for-profits to develop some idea you have. Is that what is going on?
No, so these are our annual budget requests. The way to think about budget requests is think of it sort of like a list of things that we want the city to fund.
So you want the city to fund the development of a community center. So
Exactly.
So you're gonna ask for $2 million, say, to transform some space into a community center, which comes out of the New York City budget and whatever division you go to, I guess Center for Aging, or maybe not. And so it's a request for money. You're basically going back to the city, say, you folks need to develop this community center, and this is the kind of money you need to put into it. Is that right?
We don't specify in terms of how much money they need to put into
Okay.
it. That we leave up to others. Our role is, our role specifically with budget requests is, we say we want a certain thing, like we want a senior center, a community center, or whatever. This is why we want it.
Okay.
And then, like the city decides to do what it may with that. What is really up to us is if we really believe in these requests, to advocate for them consistently with the city.
So
Like with our
like-
council
Yeah.
person, is that
With-
who we work with?
With council people, with, potentially the mayor's office, with the
Okay,
appropriate
got it.
agencies. Because, sometimes it takes like 10, 15, 20 years for certain things we want to become a reality. Which, I wish it didn't take that long sometimes, but sometimes it takes persistence over.
So I have a
many years.
question. So let's say this committee and this community board makes a typically request for the mayor's office of contract services, MOCS. And there's funding for all these categories that we've talked about. But normally I know specific entities that apply and then they could be granted those monies. But here we're just suggesting that they invest in this in a neighborhood, right? So
Yes.
nobody has ownership of it. Do you see what I mean? Because the request is going to an agency that extends this money out to other companies and not like as I said, I do it in a very small way because I run a nonprofit and we reach out to the council member in our districts. And they say, okay, through our discretionary funding, we will award you this much money because we believe in this, for instance, for like St. Martin's Park or whatever. And then your organization then processes, that they will say, we grant you $10,000. The city, once they say it, city has no issues, then you just interface with the city in getting that money, processing, and then, showing proof of delivering on that. This is obviously a very big ask. It's millions and millions and millions of dollars. So I'm just wondering, that means we want some city agency to take charge and run with it. That's what we want, right?
Correct,
That's what
and I will
I
say, in our request, we do specify which agency we believe would be the responsible agency, so.
But you don't have the middleman in there, which is what you're describing is, we have the idea, somebody can enact it, and then you get funding sources, right? And so, but what we seem to be doing here is we have the idea, and then we go to a city agency and say, well, I guess you take it over and do it, because we don't have that, we don't have anybody,
You're saying
we
need
have a
to-
hole there.
Yeah, I
That
guess
doesn't
what
work.
we have to do is keep inviting elected officials to our committee and say, this is what we feel strongly about. This has been on the table for a long while.
But that
Right.
still doesn't deal with what you're talking about, which is who's gonna,
But he's saying we need the city to run with it.
but does the city develop centers like that? Is,
That's what we're asking for.
No, but do they do it? Do we know that in fact they have opened up community centers in other parts of the city?
Yes.
They have done
Yeah,
that.
really, I
In
usually do
fact,
nonprofit.
one of the-
It's
one of the questions-
manned by the Department of Health. So let's say if
Well,
we have a space
That's
and we have,
different,
and we have the building, we can easily collaborate with the Department of Health to give us some manpower to assign a doctor or a nurse in there. We
Yep.
can also ask NYU Langone, we can also ask Mount Sinai to collaborate with us. All we need is a building, location and a building.
But that would be a different kind of community center. That would be a health community center. as
Yeah,
opposed
it's
to a-
community health center.
Oh, but we just said, no, let's do it the way we did it. We said community center, not community health center. Right, so it's in that, we've got a quality of life issue, right? We want to improve the quality of life, not directed towards doctors and nurses who would be there. Then, has the city ever developed its own community
Yeah.
centers with that in mind? No.
Originally, it was meant to have a health center
Okay,
because we don't have any health center within our district.
okay.
It, more than probably 10 years ago, we had one, but it was closed.
Got it. So, but it's two different issues, that's the
Yeah,
point.
they just made it broader to call community, but we will have health
Yeah, it's
in
more
there
like
to
a
cater
clinic.
for,
Yeah,
to
but that's
cater
like a
for the
clinic,
needs
right.
of older
Right.
adults.
I think the question I'm probably raising here on this committee is, do we want to stick with health in a one sense, or do we want to stick with health in a larger sense, right? So if you talk about quality of life, you're talking about it in a larger sense, right? And if you talk about health, you're talking about it in a narrower sense. I'm suggesting we talk about it in a larger sense, and then the question is who would fund that, right?
But when you
because-
say larger sense, you mean like a social center?
Yeah, exactly,
No,
right?
that's why
Quality
it
of life
got-
stuff for all
yeah.
the people, that was how I started this.
That's why it's just called community center.
Right, but the question we get to is, are we wasting our time? If there's somebody who funds something like that, then we don't talk about it, right? If we have an idea, but in fact, what you're clear about is, hey, the city doesn't fund that, and we're not going through a middleman, then we need to drop that. And so I just need the data in there. Is
Because what
there-
you're describing, I feel like we could advocate with local elected officials and the local hospitals, because one of the benefits of Midtown is a tremendous medical support that we have in the form of 3 hospitals just down the street, that they all also have public space, and maybe some kind of push can be made that we advocate for them to designate a public hall that can be used for the kind of health a community center that you're describing. That sounds to me like in the old days, we used to call it clinics, where people can come and get their vaccines no matter what age. You know, in our district, that kind of, rather than go through all the machinations of going through NYU or New York Presbyterian and filing a million paper. So that's the difference, but maybe rather than, maybe there's another way to skin the apple here or peel the potato here, is that maybe we ask what's already there and see they can carve out a little space, even if it's once a month. They can say, how about Beth Israel and Bellevue and NYU collaborate and fund this little clinic, what you want to call community health center on First Avenue. That's easily accessible to everybody.
It's stated in there, we believe that a new community center in our district, which can provide critical services, programming and
Right.
positive health impacts for not just seniors, but
For
for
everybody.
people of all
I'm just
generations.
saying this might do it, because there's so many, I attend all kinds
Yeah,
of.
it's been there in the budget for 10 years already.
I'm just saying we should.
So, we need also the office to push on that.
So now, so our first issue is to get Community Board 6 itself, to get behind the bandwagon for this.
I'm not
No,
interested.
no, I'm
in that
asking
one.
them because I'm just a newbie.
Yeah,
I'm
just
just
trying to figure
digesting
out
and
where
trying
we're
to
going.
learn, yeah.
No, that's fine, but
Brandon, what
either
can
we
you say?
should be
I mean,
opening up new issues here,
Yeah,
right?
well, any of the
No,
budget
but I think this
requests,
is worth pursuing.
any of the budget requests that we have that passes at our full board meeting in October, because like, you might know this through your daughter, but every October, a list of budget requests that we have for the city passes the
Oh, I
community
see.
board at full board, so. any
And
budget
ours haven't been, this one hasn't passed yet.
Not in its current form. Like
Okay.
in its form as a new senior center, last year it passed the full board in October. Any budget request, like the list of budget requests that passes our full board, it means that the community board is saying, these are the budget requests that we want the city to carry out. Now, as to whether the city carries it out, results vary, definitely.
Anyway, I think we should move ahead. So, any other issues that you think we should handle? I have,
Oh, go ahead, sorry.
or-
No, I said, but I don't know if this is a good idea or not, but I know under the Manhattan Bridge. I know they're doing construction now, but they had, at least at one point, they had all these exercise equipment, that people would use.
Manhattan Bridge.
It's not in our
But that-
district.
That's
but-
not, yeah,
Correct, yeah, no, it's
But the
just
idea
a
is
proof of
great.
concept, it's a proof of
Yeah.
concept. Yeah, not that it's in our district, but a proof of concept that they had all this, people would just come exercise there, they had all this exercise equipment. It was just a nice thing for the community wellness, it just sparked in my head because you mentioned obesity as one of the top, issues. Obviously in our area and other areas, so just throwing it out there, I'm not sure if there's a space for it.
where do you envision to have that?
Well, they have it, under the FDR, there.
You mean remote
But
sort of
John Jay
walking?
Park has similar, I think the idea again is another fantastic idea. John Jay Park in the Upper East Side, because I've worked a lot we are stewards of a park in that general district, has it and people use it very, very faithfully. So even if you put a few pieces in St. Martin's, which I know has a decent budget, and then now the stuff that they're building along the river, maybe there's one, it depends, we can get a fitness expert who can say what can go well, but there's certainly space to put one or two things. I see people always working out on that kind of equipment. Even near Astor Levy, I'm trying to remember, there is a little green space where people have one or two working out systems, and people are always doing all kinds of things there. So I think, we can be in a more cohesive way, have a much more expansive health and wellness segment in the parks that are in the district. It is an investment in money. I think those are not
Yeah,
cheap.
where do we get the machines?
Well, I guess wherever they got them for the other sites.
You work with New York City Parks Commission. And
Yeah.
we can certainly contact the Commissioner of New York City Parks and tell them to come and do a presentation and tell us what is involved, how one can go
How
about
can
getting
we
it.
open up?
I think that would be a great,
Okay.
great thing to do.
One of the issues now is much of that area, the East Side Drive part, it's been really ripped up. I was actually shocked that it's the bike, everything's gone, and so I'm not sure even how far down, my guess it goes, maybe it's open till Houston Street, but I think everything else is gone. I don't know.
They're trying to make a complete circumference of the island, right? They're trying to have a walkway, a running path.
Yeah, but right now,
all around the island.
yeah.
I think it's in the construction phase right now.
But it's huge, and that's gonna be, I certainly know the part that's in the 20, and 20 probably down to 14th has been going on for years and years, so that's a problem too. That's whatever, we need information about that anyhow, I think, to know what's.
Okay, so we can probably invite somebody to come. I mean, in October, we have already somebody coming from NYU. So, I don't really have any chairs report, but I have something that I wanna propose. During the pandemic, we had series of, presentation. How did we call that?
I think it was the healthy livings.
The community healthy livings, isn't it? So I'm proposing that for November, if we can get a speaker for COVID vaccine, West Nile and impacts. And we can collaborate with NYU So in place of having a meeting in November, we can have that presentation, like for 2 hours, if we can get 3 speakers. Can you get a speaker from Mount Sinai to do any one of those?
On vaccines.
COVID vaccine,
Mhm.
then West Nile and Mpox.
And, okay, I can, work on that.
If you like, I can inquire of someone at Anthem. She's a geriatrician. If she can recommend someone, if you also need additional
Or-
speakers. Since you've given the
Yeah.
topics, those are the
Yeah.
topics I'll go with. She,
So let us know which topic can we get from Mount Sinai and
what was the third one? Is West Nile,
West
COVID,
Nile, Mpox, monkeypox.
monkeypox. Okay.
Is that one, you see that as one,
We have a
Uh,
rise of Mpox right now, and also West Nile. And we wanted the topic of COVID vaccine. Do we need to continue having that annually? Or,
right,
there are so many questions about that.
seems like one speaker could cover the 3 subjects, like
Mhm.
one infectious disease. Doctor
If,
could cover
if
all
we
3.
can get one person to cover, that would be great, but if not, we can get 1 or 2.
I will
And,
work on that, that's for
it's
November.
for November, so in place of having a meeting in November, we can have that. Because we can have, one topic can be 30 minutes. 30 minutes for each topic, that's an hour and a half. And then the rest of the 30 minutes will be question and answer, Q&A. So we will have 2 hours of via Zoom,
So this will be a Zoom event.
yeah.
Okay.
I
Via
certainly know
Zoom.
an epidemiologist, but they're not in New York, who might be happy to do it via Zoom. So that's a backup if you need it.
Because if you can get from Mount Sinai, we don't have to get from NYU.
What is the date?
So, it's gonna be November. Our meeting is supposed to be November 14. And also, I would like to ask, we don't have a quorum, but I would like to ask members if you agree to change the date of our meeting, because it's one after the full board meeting. If it's too much, you can look for other dates.
You mean on Thursday?
So we are always held
We
the day
always
after the
have the
full
day,
board.
yeah.
I personally would really like it if it's
Yeah.
shifted, but
It's fine.
I defer to everybody else.
I had another thought about this, of what one might be of interest, what would be of interest in the community. I don't know if it falls under health. But the issue of, kids and cell phones, and it's coming out, and that parents don't know what to do with this preoccupation. There's also a lot of, it's 2 things I think of, which is, there's also rising levels of anxiety amongst teenage girls and so on, all of which filters down to parents trying to make decisions about what to do with their kids at this age with their phones and the preoccupation with it, and what happens in the class and so on. And I know Adams decided kids should keep the
Yeah,
phones,
there's
say whatever, but the notion of, and that could well be a panel of, what are the issues? What are parents concerned about? What happens with kids? What does that mean in the community for this, the fact that kids spend enormous amounts of time on social media and so on? I could think that would be, that might be an interesting, panel.
I think that might be under the Committee on Youth
Okay.
and Education.
It could fall under youth and education, or it could fall under this committee. I mean,
It is health related, it's mental health.
Mental health, we
Yeah,
left
I mean-
mental health out of this, which is contagious.
it involves children, so there is a youth aspect to youth and education, and as Mubin correctly pointed out, there's a mental health aspect, so it could involve either committee, honestly. Like if that's the sort of thing the committee would consider, what I would just advise is, talk with the leadership of the Youth and Education Committee
Yeah.
about it, just to make sure that
Yeah.
if it's something this committee wants to take on, that they're okay with us taking it on.
Or it can be a joint.
Collaboration, yeah.
So, but regardless, it would be important to communicate with the leadership of the Youth and Education Committee, just to avoid any
Yeah.
potential clashing.
Anyway, going back to the changing the date, do we need a quorum for that?
No, but I think since we don't have a quorum, I think it would be important, like, quorum or not, it would be important to poll the committee, I think,
Okay.
on potential
So-
dates. So what I would recommend, Elvie, is that you like pull together like a list of dates that you're thinking of for when you'd be interested in meeting, dates that work for your calendar, but also dates when there isn't another committee or
Another
full
committee
board
meeting,
meeting.
yeah.
So, for example, the first Thursday of the month would not work. That's when public safety meets. So what I would suggest, Elvie, is pull together a list of like times of the month that you would be comfortable
And I'll
the
ask
committee
the members.
meet, and then from there, we can have a few options that we can poll the committee members on.
Okay.
That's how I would
do it.
recommend going about it.
All right then. Okay, so any other new or old business? No other new or old business, so that means that we will adjourn the meeting. And thank you so much, Sandra and Eugene for coming.
Thank you.
Thank you.
Thank you.